YMCA education series is free and open to the public, so we encourage you to spread the word and invite family and friends to participate. We host approximately 8 to 10 of these programs a month, varying in all different topics. This program will last about an hour, and you might find that you have questions during the presentation, which we will be happy to address at the end of the program. When you have a question for the speaker, simply type it into the chat section on your screen, and I will relay the question to the speaker at the end of the program. You may also raise your hand and ask a question yourself if the chat button isn't working for you. I ask that you please keep your questions general, and we will do our very best to address all of them in the time allotted this afternoon. Thank you again for joining us this afternoon, and now I would like to introduce you to Denise Schwartz from the Manual Touch Physical Therapy. Denise is a licensed physical therapist, specializes in treating pain using a holistic approach to discover the root cause of pain and provide natural healing for options. And go ahead, Denise.
Sorry, I'm still playing with my lighting here. Hold on. I didn't like that. It was like, I thought I'd open the blinds, but then it was flashing lights. So, hi. Hello, everyone. I was going to say good morning, but I guess it's still morning. I'm Denise Schwartz. I'm a physical therapist here in Wheeling, the owner of the Manual Touch Physical Therapy. I'm at Milwaukee and Dundee. Irene, you missed our little talk before. We're recording or videotaping this, so you might want to turn your video off if you don't want to be on it and recorded. And please mute yourself would be great.
Oh, okay.
Thank you. Terrific. Anyway, so I'm a physical therapist and the owner of the Manual Touch Physical Therapy. I'm in Wheeling at Milwaukee and Dundee. So I'm just at the boundary of Northbrook. I've been a therapist a very long time. We use a whole body approach of traditional and non-traditional therapy to get people back doing the things they love to do. When I got out of school a long time ago, over 30 years ago, I knew that back pain was the #1 reason people called their doctor. And as such, I went to a lot of continuing education classes after I got out of school to become an expert in back pain. And those were a lot more traditional techniques. And I did really well with people for a long time. And then I started studying a non-traditional technique, which uses my hands and to look at the body as a whole person. And I found I could help a lot more people than with my traditional techniques, people that I couldn't help with before, people with chronic pain and chronic conditions. And then I left the hospital to join with a company called Center for Integrative Manual Therapy, where we did this holistic type of manual therapy for very complex people with complex problems. In about actually 11 years ago, next week, we parted ways and I opened up the Manual Touch Physical Therapy. And what I decided is all this traditional stuff that I wasn't using with the new clinic, the non-traditional clinic, was still really good stuff. So I brought that back in and I combined the two and I use both with the people who come in to see me. Along the way, I developed a specialty for running and triathletes. And currently we see mostly people with any kind of pain issue. And today we're going to talk about hip pain. And I am going to share my screen. Oh, let's do this. Okay. All right. I know you guys are all on mute, but if somebody could tell me they're seeing this okay, let me know. One more thing I need to get organized here. Hold on. Yep. Heidi said we're good. And as Heidi said, sorry, I'm looking for, oh, here it is. There it is. Okay. Can you see my mouse moving around this little arrow? So as Heidi said, it's easier on these Zoom presentations to do questions at the end. So please save them up, and we will get to, I have plenty of time afterwards. We can answer any questions. If you have something that's very unique to you, most of the time people have a question that other people can benefit from. But if you really want to tell me your story, that would be better to set up a phone call with me, okay? Okay, so today's talk is about hip pain. And I've been doing these talks at the Y now, I think 3 or 4 years. Karen Brownlee told me I was actually one of the earlier ones. So I didn't realize she had just gotten it started. So I've done most of my talks have been on back pain. I've done a talk on heel and foot pain, shoulder pain. And actually, this is a brand new talk on hip pain. I've done it a couple times, but not for the Y. And I see a lot of people with hip pain. Now, when someone comes to me with hip pain, we need to ask, where is your hip pain? Because where people think their hip is different. Some people come in and say they have hip pain in their butt or their back. Some people's hip pain is in the front. Some people, it's down in the groin area, so going down into the inner thigh. And then majority of people, it's on the side of their hip. So all of this information, depending on where it is, kind of points us in a direction of what is going on. When we are in person, I would often interact with you and ask you, when do you have hip pain? And I'd have people yell out and tell me what's going on. But again, that doesn't work so well with Zoom. So here are some of the common complaints I get with people. People who have pain in the front of their hip, usually it hurts with sitting. Actually, the front or the back, usually it's sitting, okay? Sometimes it's after you're sitting a while and then they get up to move, then their hip hurts. People have pain in their hip with standing or walking, laying on their side, difficulty putting on their shoes and socks. They might not be able to bend down or squat. They just feel stiffer in general. Things just aren't moving the way they used to. Rolling over in bed could be bad. And then, of course, people just can't do what they really like to do, particularly some of those more active sports, running, pickleball, tennis, bowling. But I used to, when I had some hip flexor issue, which would be the front of the hip, I would do the elliptical, and I'd have to really make sure I stretch out before I get on the elliptical. I don't know if any of you go on the elliptical. Sometimes, depending on the one you're on, you can get it angled up pretty high, and that could be kind of a challenge, as if you're climbing up a steep staircase. So it could be anything. This is a copy of an ebook that I have. This will give you some tips on how to protect yourself as you go about your day. When I'm in PT school, or all therapists are in school, one of the primary things we learn is how to protect ourselves so we can help you. Back in the day when I worked in the hospital, I worked with people who had to help them get out of bed. I had to help teach them how to walk and really hold them up, or they had balance issues and I had to protect them from falling. Some people who couldn't stand up out of their chair. So we need to learn how to use our body to help you. So I created this book for tips as you go about your day so you can protect yourself. So maybe you don't need to come see me so you don't hurt yourself. So the way to get this ebook is, please put your email in the chat box, and then maybe Heidi, you can gather up those emails for me at the end, and I will send you out a thank you note and a copy of the ebook. All right, so let's talk about the hip. Let me see something here. Just looking at my pictures. All right, so this picture is the front of your hip, okay? This is your spine. This is your pelvis. And here is your femur, which is your thigh bone. And that thigh bone takes a nice sharp bend here. and you can see it over here easier. You can see it goes into a socket part of your pelvis, okay? So this is the hip joint, all right? And all this pink stuff are the muscles, some of the muscles surrounding that joint. When people have hip degeneration or arthritis, it's right in here in this joint. One of the indications that people might have hip arthritis or degeneration, people will complain of pain along this area, so your groin area. When you come in and we examine you, someone comes in, their doctor sends them in, or you just call to come in because you're having some hip pain or you're having groin pain. If I find that you can't move your leg or rotate it very well, or you really have loss of mobility, what we call range of motion in the hip. I have a good picture of that. Let me see here. I'm not sure I'm not gonna be able to show it on me either. But think about, like, if you were to try to lift up your foot to cross your leg, put your foot on your other knee, that's rotation, one direction, and then if you had to rotate the other way. So we're gonna look at, see if you can do that rotation. If one of the directions or even both is really stiff and stuck, might be an indication there's something going on in the hip joint itself. Okay. All right. So what says here we got your lumbar vertebrae, ilium. All right. So now let's talk about some of the muscles. We didn't label the muscles here. You know what? Let me talk to you about these muscles here. All right. You see this long one? This is called your psoas, P-S-O-A-S. It is your hip flexor muscle. And that's the muscle that you use to lift your leg up in order to put on your shoe and sock, in order to lift your leg up when you're going up the stairs. And as you can see, it attaches down here on your thigh bone, your femur, and it actually attaches up here into your spine. So when sometimes people have like mid to low back pain here, sometimes it's because of this hip flexor muscle. And the way we can tell that, I can palpate or poke around in the front of your hip and feel this tendon. If it's tender, it's likely it's that. I could go through your abdomen kind of deep. People don't love it so much, but we can land on it. And all your guts, your colon and so forth, kind of moves away, and you can get to that muscle here. And if it's really tender, then we know that's part of the issue. This is a muscle called your iliacus that's on the inside of your pelvis. And then these are your hip adductors. Those are the inside of your thigh. They bring your legs together. This is commonly known as your groin. All right, so this is what we call a posterior view. That's the back end. So if we're looking at you from the back, these are the muscles that are the back muscle, or the butt muscles, if you will. Right here is what's called your sacrum. So if you see here, here's your spine. This is the sacrum down here. So we're looking at the back side of this. People often hear the word glutes, but you actually have three glute muscles. You'll have your glute maximus, which is a big muscle that covers all this, and you don't see it in this picture because we want to see all the muscles underneath there. And then we have your glute medius that's right here, and that's also cut, but that comes down and attaches down here, where a lot of your hip muscles attach right onto this femur. And then you have your glute minimus. This glute medius is extremely, extremely important. This is the muscle that helps you stand on one leg. This is the muscle that really helps stabilize you. It's the one that you bring your leg out to the side. I think often, if you guys go to the Y, they might have a machine called your hip abductor machine, where you open your legs and in and out. That's tackling this muscle right here. Underneath there are your deep rotator muscles, your deep pelvic floor muscle. There's multiple names. Rotators, those are the ones. Remember we talked about rotating your leg, like you're going to cross your leg over to put your sock on. That's what these muscles do. That's their primary movement. But actually, their primary role is they actually stabilize your pelvis as you walk and move through life. And they have a lot of names that nobody really ever hears about. The gemellus superior inferior, quadratus femoris, obturator internus. It's not commonly, it's not in popular literature. We might just call them your deep core muscles. People do hear of your piriformis. That goes across, that attaches to your sacrum and comes across and attaches over here. A lot of people think they have a piriformis problem when they have a pain in the butt. I just don't find that as much. When people have pain in their butt, it's usually here. It's your sacroiliac joint. That's where I find people have most of their problem. This here again is another picture of the piriformis. This also shows the sciatic nerve coming out of your spine and down the back of your butt, and it goes down the back of your leg. And you can see it actually goes between some muscles. So sometimes people might have pain in the back of their legs and sciatica, and it may not be coming from up in the spine, but it may be coming from a muscle here, like this is being pressing on it, the piriformis. So it could be a strain there, but usually what I find is this is strained because there's a little bit of a shift in the sacrum here or the ilium. And so you're going to get some tension on that piriformis. And when it's tense, a little more tense and tight, it presses on that sciatic nerve. Okay. All right, we got the anatomy here. What I want to say about these muscles, these deep core muscles, 9 times out of 10, when people come in to see me with any kind of problem, they almost always have a problem here in their deep core. These muscles are just not doing their job. They're little, they fatigue out quickly. People do not know, they're supposed to work subconsciously, but for whatever reason, they stop working for some people. Now, they're working, but they're just not working optimally or efficiently. And so people fall apart somewhere. It could be in your back, it could be in your hip, it could be your knee, it could be your foot, it could be your shoulder, it could be your neck. And so oftentimes this is the key to healing almost anything, okay? So it's very important. So if you go to see someone for a pain problem and they're not looking at your core or your deep core, you need to ask them about it and check. Because if this isn't doing their job, it's kind of like, well, this is a terrible, terrible example because it's such a horrible story. But it was like that building that collapsed in Florida. So the base was wearing away from all the salt water. This is your base. And if it's not functioning, things can collapse anywhere. So you may go in and they may, let's say, go in for shoulder pain and they're working on your shoulder, which needs to be done. But if they're not integrating this with your shoulder, you're just possibly going to get injured again, or something else is going to happen. So this is really, really important. Okay. This is another picture. This is a picture of your abdominals. So here's your six-pack muscle, your rectus abdominis. Everybody has a six-pack muscle. You just don't see it outlined. Okay. These are your obliques. Those are muscles that come in from the side, and they kind of come down on an angle like this and the opposite angle. And then deep underneath there is your transverse abdominis, which is kind of like your body armor, and it supports, it goes all the way around your back. It goes all the way up to the diaphragm and down to the pelvic floor. That, in addition to these little muscles here, are the ones that really have to do their job to stabilize you so you can function and prevent yourself from getting injured. All right, so I think that's everything with the anatomy lesson. So let's talk about what are the three most common causes of hip pain? We briefly talked about arthritis or degenerative joint disease. If you remember, we talked about that here. That's in the socket. Here, this is called your acetabulum of the pelvic bone, and this is the femoral head that sits in there, and it looks like a ball and socket. And what happens is the tissues inside the ball and socket, your cartilage, the labrum, it wears away, and this becomes narrower, and then you get kind of rubbing in there and a wearing away of the joint, and some extra bone is built up. When people have this, and it's pretty significant, I'd love to say we can do miracles and help everybody, but really the best thing is to get that replaced. So I often send people in when I see that, that they really need the surgeon to take a look at it. Okay. The second most common cause of hip pain that I see is just weakness. Okay. So women are more prone to the weakness in the lateral hip muscles. The lateral hip muscles are the ones that are on the side of your hip. That's that glute medius muscle that comes right into here. Your piriformis muscle comes into here. Those become real weak. Why are women more prone to that? Because we have a steeper angle, but we have wider hips, and our knee goes in, and this just sets us up for a possibility for weakness in this hip. And so when I'm working with people, I am really retraining you to how to use those muscles so this angle doesn't overpower you. The trick when you have weakness in your hip and people come in and they say that they have pain, on the side of their hip there when they walk. The unfortunate thing is this is one of those conditions, kind of like when you get a total knee and we have to really bend it. It's going to hurt a lot. We need to do exercises to strengthen that muscle, which will make it hurt, but it will make it stronger. The challenge is finding the line between, are we irritating it more or are we actually strengthening it? So that's where your physical therapist comes into play to really teach you how to strengthen this appropriately so you can get stronger, and then you won't have pain. Okay. One of my best friends last year during COVID was walking twice a day. I want to say 10 miles a day, but it really was probably 6 or 8 miles a day. And so that's walking. What's the big deal with walking, right? She was somebody who always worked out on a regular basis. She went to the gym. She used to be a swimmer, then she moved into the elliptical. Anyway, she was walking 8 miles a day, had severe hip pain. And here's her little bit of her story. And sometimes my friend doesn't tell me what's going on. She likes to just figure it out herself. But in this case, she actually went to another therapist because her insurance covered it there, and it never quite got better. And I said, let me take a look at you. And when she came in, the problem was those little hip muscles, those pelvic floor muscles I talked about. This is why she had severe hip pain. The other therapist didn't address this as readily as we did. And so after, I think actually within a couple of weeks of doing the exercises I gave her, she was feeling better. And then over a couple months, it went away. So here she gave us a nice little testimonial about that. Okay, so what's the other? The other most common cause that we see in therapy of people with hip pain is a tendonitis or bursitis. So tendonitis, it could be in any of those muscles. So you could get a tendonitis in those adductors here. So that's in the groin. So you could have groin pain, and it could be muscular, or it could be your hip joint, which is worn away from degeneration, or it could be a tear of the labrum, which is a soft tissue that covers the joints in there. We don't see that as often. The hip labral tear we'll see more in people who are pretty active pretty athletic when they were younger. And I'm talking like collegiate athletes, that kind of thing. We don't see that as much. Usually the most people that come in, they have the arthritis in there, or they actually have a groin pull or strain, and it's in the adductor. You could, and we could also call that a tendonitis. You could have it in this hip flexor. Remember, we talked about that. Here's the tendon that crosses here. That's when this gets irritated. That's pretty common right now with people who sit all the time. This gets strained, and you go out. You know, where I see this a lot is people who work out at night after they've been sitting all day. They just expect their muscles to, okay, we're going to go from 0 to 100, and something falls apart. So that's where you can get a tendonitis there. The front of your the front of your thigh is your quadricep, and it's not in this picture, but that tendon also crosses here. So it could be a quad problem. A lot of times the tendon, it could be this glute medius we talked about. Not only do you have a weakness, but it's more of an inflammation, and there's tendonitis there. I think that's it. Okay, so that's it for the tendinitises. Bursitis. Bursa is a fluid-filled sac that is over any bony prominence. And so usually that's on, there's one right here on the outside of your hip. So when people tell me it hurts to lay on their side at night, usually I find there's an issue right here. I have a theory that those bursas, it's fluid-filled, tends to dry up a little bit as we get older. And I think when we're in beds that are too hard, this can wear away more and it gets irritated. So it's actually important to, as we get older, to have a bed that has a softer, cushiony, more cushiony top to it, so it molds to our bony areas, because we just don't have that cushion that we used to have when we were younger to protect us. Okay. So we talked about, here's a little bit more information about arthritis. When people come in, you know, they have groin pain, they have loss of mobility in their hip. Usually there's a significant limp that we see, a change in their gait, that they're walking. And sometimes people come in with low back pain, and we have to discern, is it coming from your SI joint or your hip joint? Weakness, we talked about that. The hip rotators, your deep core, pelvic floor, the glute medius. I usually find a problem in the foot as well with this. If this hip is weak, let me see. This isn't a great picture, but what I would see, if you had a hip weakness, we might see at this point when you're standing that there would be, this shirt would be angled down because this hip isn't working the way we want it to. Okay, and when that hip stops working or isn't firing and this hip drops, then you get a foot down here where your foot pronates and falls in. This woman actually has a pretty significant issue and needs some braces there because of that. So we need to, so if you go somewhere and someone's just working on your hip or your back and they haven't looked at your feet, that's a problem too. Kind of like that really sad story of the building coming down. This is your base and your pelvis is a base. If those two aren't working the way they need to, something's going to fall apart above there. And we call that poor neuromuscular control. So when you come in for therapy with either me or Kevin, he's my other therapist here, we're going to work on getting all this working together. Let's see. Here are some other tendonitis or muscle issues that I might have forgotten about. Okay, there, we forgot those two. Let me show you that one. I don't think I have a good picture of it, actually. I don't have a side view. But on the side of your hip or the side of your leg is the side of your femur. Here is your, your IT band, and it attaches to a muscle up here called your TFL, your tensor fascia lata. So people will come in and they'll have pain here on the outside of their knee, which is indicative typically on the outside below the knee. is the IT band is a problem, the outside of the leg, and sometimes it's because this muscle up here is strained or is tight. Anything else I forgot? So there's a lot going on around your hip and your pelvis, and there's a lot that we have to discern, where is it really coming from? So one of the things we want to do is determine, is the pain reproducible? So when I make you check out your strength, or I mobilize your hip, does that hurt? Or does it only hurt when you walk, but when you're sitting, it's fine? Those are things that are reproducible, and then we know we really can work on them. When it's not reproducible, in other words, you kind of have pain all the time, it doesn't matter what position you're in, it just doesn't seem to go away, then, more than likely you need to have some medical intervention that we need to send you on. For example, 4 years ago, I started having some back pain, and I'm one of those lucky people who don't have back pain. It was a Monday, I went out for a run, it didn't make it worse, so I was fine. By Tuesday, it was feeling worse. By Wednesday, it was radiating around the front of my abdomen, down into my butt. And by that Wednesday night, I couldn't find a position to sleep in. So by Thursday night, I said to my husband, I said, there's something wrong. I can't reproduce this pain. I can't reduce it. I can't get a comfortable position. I need to go to the emergency room. I went to the emergency room. I told them we couldn't reproduce it. It wasn't musculoskeletal. Because it was my low back, they figured it must be kidney related. So we did tests for that. By 2 in the morning, they're like, we can't figure it out. They sent me home with Vicodin and said it must be muscular. And because I couldn't fight at that point, I'm like, okay. Well, a week later, as it was slowly getting better, a full week later, I scratched my back and I found I had a rash. So I had shingles. So there's another clue for you. You can have shingles without a rash before the rash shows up. And it's really hard to diagnose. So that was not reducible. So it was not musculoskeletal. Typically, physical therapy cannot help with that issue because you can't make it go away with anything that we do. Now, I do find there are some non-traditional therapies that help with some conditions like shingles, such as acupuncture, and some of the non-traditional stuff I do is helpful as well. But really, I needed the antiviral. It's important to figure out what's going on in your hip because the diagnosis will dictate how we do your exercises. There, of course, is quite a bit of overlap. Most people, everyone comes in with a weak core that's not interacting with their feet very well, and so we have to work on that. But if you got pretty severe arthritis in there, we don't want to push and stretch those hip muscles too much. It may seem like they're tight, but it's really going on in the joint. And so we need to know what's going on there. So it is really important to figure out what's happening. The biggest mistake people make with hip pain, they ignore it. Okay, it's really better to try to do something about this sooner than later. Okay, some people just think I had a guy yesterday. Somebody kind of on the young side. He's just turned 65. I saw him a few years ago for a shoulder problem. And he has been having some hip and knee pain for the last 4 months. He thought it would just go away. He's really big into yoga. He's very flexible. But it wasn't. So then he came in and I decided it was a little challenging to figure out. I think it was mostly a pretty severe case of IT band problem and maybe something going on in the hip joint. But we're going to keep an eye on that. All the tests were negative for it, but I sort of suspected that. But we're going to work on this IT band and get him more mobile. So don't wait. If you've got a problem, give us a call as a nice thank you for coming in to the seminar today. I'm happy Kevin and I would be happy to talk to you about your problem, either phone call or a telehealth call to discuss what's going on with you and kind of give you what we think recommendations, what we could do for you or where we need to refer you on. Okay. Here's another little testimonial. A woman I worked with a number of years ago who had had hip pain for quite a while and nothing was really working. She came in and we did a lot of different exercises, a lot of different hands-on work. And she got to a point where she felt stronger and more stable, and she's walking and she's more flexible and she can do all the activities that she likes to do. And she was really excited. And I haven't heard from her in a couple of years. I think she's still doing pretty well. So good for her. So what happens when you come in for physical therapy? Well, one of the things we do is we do some hands-on work, which is called manual therapy, finding where the issues may be limiting you from healing, to promote the tissues to heal and work with your body, give you exercises to build strength, build better mobility, and balance. Balance is really key. When your hip is off and there's a problem there, you're going to have a balance problem. What's the problem with the balance? You could fall. So this is really a problem. Okay, so it's very important to work on your balance. Then the biggest piece that we work on with you is what we call neuromuscular re-education. And this is where we get your body, your whole body working together, making sure your feet is talking to your core and your pelvis. If you're coming in with a shoulder problem, is your shoulder talking to your core and your feet? Think about a baseball pitcher. You know, that power that they're getting, it's not coming from those dinky little shoulder muscles. It's coming from their big butt muscles. So all that energy coming up from their body through is transferred to their shoulder to throw that ball. So that is the most important piece. And typically when you have pain, this is all thrown off. And things just are not working together well. Okay. All right. So we talked about, please feel free to give us a call and schedule a time for Kevin and I to talk to you to go over your issues, and we can give you some recommendations on whether you should come in or see a doctor. If you have Medicare, you do need a prescription to come in. If you do not have Medicare, you can just come in without a prescription, which is just wonderful. So you can take care of those problems sooner than later. On my website, there are some articles. I've written some blog posts about hip pain, and here are some links to that. Again, if you put your email in the chat box, and then Heidi can get those to me, I can send you a copy of this PowerPoint, which will have the links to these blog posts. In addition to, you'll get this ebook as well. Feel free to email me at denise@themanualtouch.com, or give us a call to schedule up a phone call or a telehealth visit so we can go over what's going on with you. I'm going to give you a moment to just write down that information, and then I'm going to stop sharing the screen so I can answer some questions. Maybe what I'll do is, no, can't copy it. Okay. Oh, shoot. Okay, can you hear me now? Did you guys lose me before? No? Okay. All right, my speaker died over here, but now I'll be able to hear you. I guess you can still hear me, which is good. All right, anybody have any? Oh, wait, I see a question. Aha, so this woman, I think it's a woman, she wrote down that she went to 2 doctors, and one told her she had hip bursitis, and one told her she had sciatica. So that's the tricky part. So unless you see a doctor who really specializes in hip or back, sometimes they can't distinguish between the two. Typically, the physical therapist will be able to distinguish between the two. The hip bursitis, remember we talked about usually people, it hurts when they lay on their side, but it could hurt when you lay on your side if you have sciatica as well. So what else do we, usually we tell this sometimes by palpation. When I touch the area on your hip, if that's really tender, that's often a bursitis issue. And it might hurt with walking, whereas sciatica sometimes hurts with walking and sometimes it doesn't. Sciatica might hurt with sitting if it's coming from a herniated disc. If you're having sciatica because of stenosis, that hurts with walking. So it is pretty tricky. We sort of have to poke around and decide. Also, we look at the mobility depending on what triggers the pain. Okay. So if we move your back, does that make your sciatica worse? Or the hip pain works? Then it could be coming from your back. If we're moving your hip around and checking the strength there, and that makes it worse, then it's usually your hip. So it can be tricky, but we usually are pretty good at figuring out which is causing which and giving you the right movement and exercises for that particular diagnosis, as well as not aggravating something else. Does that answer your question, Anita?
Yes, thank you so much.
You're welcome. And Anita, that's your last name. Okay, any other questions I can answer for you? Okay. Well, if you want to give your email to Heidi, she can get it to me, and then I can send you that ebook. And you can get on my email list. I send out lots of nice tips week after week on how to take care of yourself. So thank you for coming. I appreciate it. And I'll see you maybe next month. Heidi, any idea if we're going to do any in-person stuff anytime soon, or people are enjoying Zoom?
I think we are looking to do a hybrid in the fall, maybe in September.
Okay.
Yeah.
Well, September, I'll be doing a balance screening, so that'll have to be in person. So
Oh, yeah.
Kevin and I will be there too. So call to make an appointment, and you'll come in, and Kevin and I will do a 15-minute real quick screen on you to see if you're having some balance issues and what might be causing that.
Great. That's wonderful. Thank you so much, Denise. I appreciate this.
Thank you. Thank you for having me.
Of course, and thank you to everyone for joining us for our YMCA education series. Sorry, hold on. So that concludes our YMCA education series presentation today. On behalf of the North Suburban YMCA and our YES series, we thank you for supporting our organization and programs like these. A special thank you to Denise Schwartz for speaking with us today. Programs like this one are free and open to everyone in our community. So if you enjoy today's program and would like to support the North Suburban YMCA, please consider helping with a donation at www.nsymca.org. We hope to see you at our next speaker series on August 4th. That's a Wednesday at 15. It is with Matt Margolis, and it's planning strategies for the caregiving child. Thank you again, and have a wonderful afternoon.
Nice to hear from you, Kathy. Take care. Thanks.
Enjoyed hearing this. Another great presentation.
Thanks a lot, Kathy. Appreciate it.
And, you know, when I get my hip pain, I'm coming to you first.
I look forward to it.
And it's not an if, it's a when.
All right. Take care.
Thank you. Bye-bye.
Bye. Thanks,
Bye.
everyone.
Thank you. Bye-bye.